The Newsfeed PM continues now. The South African government has raised concerns over the latest executive order signed by US President Donald Trump. The recent pause of foreign aid, particularly the vital USAID program, has major implications for South Africa and the continent. USAID supports millions in the fight against HIV/AIDS, providing crucial services like clean water, healthcare infrastructure, and children's health. Let's unpack this. We're joined now by Dr. Hannah-Lisa Tetteh. Good to have you, and thank you very much for coming on this afternoon. What would be the real impact on the ground for this particular decision and the signing of this executive order?
Thank you for having me. Well, I think that there's been so much communication and conversation about what is happening because, of course, the impacts could be dire in certain situations. If somebody's funding you and part of your healthcare, and then all of a sudden they decide to pull out, the disadvantages are that, well, it's so sudden, so you didn't get enough time to actually prepare for a pullout. You already have people on these drugs, and you're relying on the funds for to continue the process, and then all of a sudden it is pulled out. And so, yes, the circumstances are dire. It's unfortunate, but it's happened. So.
Yeah. But others, particularly in South Africa, would have spoken to the health minister last week. He says, well, look, they fund part of the programs, not all the programs. For example, there could be 17 districts that are affected. Yes, it's significant, but it doesn't mean that all programs, for example, that have got to do with PEPFAR would be stopped.
Yes, so most countries are saying this, and most government officials are saying this. Of course, it's important to allay the fears of the people. It's important to make people know that you're working to control the situation. But we can't deny the fact that there is some impact, especially as USAID is one of the greatest contributors to HIV and AIDS globally. So it's not just being felt in Africa, but it's felt globally. But most other countries have other sources of funding. Some of these fundings are permanent or they're consistent. Some of them are just as and when. And so that's where the challenge comes in. Those that are as and when, do you have enough money? Most countries have their internal systems or internal funds depleted. And that's also another challenge. So it's just about how consistent this was and how much they were giving. That's why we are complaining about it.
Now, for many on the continent, suppose the PEPFAR program would have been one of the most successful foreign aid programs, particularly responding to the question of HIV and AIDS. Over 2 decades, it says this program has been giving support. What happens now to those particular programs? Do they completely shut down? Is there a way of sustaining them?
So now it's 90 days. So we wait and see what happens in the 90 days. But then news going out to said that the workers have also been asked to go on an indefinite leave. So we don't know if it's going to be shut down completely. People have started losing their jobs. So if it's just 90 days, so why are people losing their jobs? I think that we'll all have to wait till the 90 days to find out if it's something permanent or it's just for a period. But then the whole thing is America first. The question most people are asking are that, is it America first or is just America only? Because there are other people that are being affected. And so is it just policies that are looking at Americans first, or the whole thing is about America only? So I think we'll just have to wait to find out if truly it's going to continue or if it's just something that is temporary.
Yeah. Men are saying, well, Africa should have anticipated the Africa First outlook by the incoming president of the United States. And therefore, as a continent, there should have been other priorities that we would have put ahead and expected at least to get funding from there.
Yes, most people have argued that this should be a wake-up call for us because we can't be solely reliant on one source mainly. What happens when that source is no longer there? So it's a wake-up call for all of us. How much are we investing into our people? How much are we investing into manufacturing or research into manufacturing of these drugs, such that we don't always have to rely on people? How much are we investing into policies that are sustainable? Policies that ensure that there's no shortage. I think that there was COVID. There was an issue of vaccine shortages. how much lessons did we pick from these situations? And so this is a wake-up call, as some people have argued. But then again, we should also look at the fact that there wasn't enough time. We were just hoping that what he was saying was actually not going to be what happens, but it has happened. So it should be a wake-up call for us as well.
Yeah. From a medical point of view, delays in, for example, getting some of the medication, especially for those who are suffering from HIV and AIDS, how detrimental could that be?
It could be very detrimental. Already we struggle with a lot of stigma that prevents people from actually going for the drugs. Now we've been able to put quite a number of people on the antiretrovirals. Now people are not as stigmatized, although they're stigmatized, it's not as stigmatized. And now we have to encourage people to take their medications. Now, when you don't take your medicine, of course, the progression to AIDS is higher. And we know that the progression to AIDS is dire for your health. It can lead to an increase in death rates. And of course, when you don't take the antiretroviral, the virus can replicate or it can mutate. So when it mutates and it changes, now there can be resistant strains. And so that's going to be a problem with treatment or keeping your CD4 count at the utmost level. Your immune system will go down. When your immunity is down, because there's going to be a reduced CD4 count, when it's down, what happens is that you are more prone to opportunistic infections or other infections because your immunity is down. Infections like tuberculosis can become, you can be at risk of these as well. So it's not a good look when people don't have access to their medications at all. Yeah. And then, of course, it will increase the risk of spread because if your viral load is high, then it now comes to detectable levels for those who are taking their medicines to the point where they had undetectable levels. And now there's an increased risk of spread to others as well.
Yeah, Dr. Hannah-Lisa Tetteh, we appreciate your time. Medical doctor there from Ghana, as it says that, of course, the impact will be felt in South Africa, but the impact will be felt also throughout the continent of this particular executive order.